Hi, everyone, and welcome to Take a Pause with Menopause, a place where we will talk about the pause in all of her glory and not so glory. Today, we are talking a hot topic is gut health. So, you know that saying, go with the gut. Well, we're going to go with our gut today as we're talking with Gisele, who, welcome back. We've had you on
Thank you.
before. She's
Yes, ma'am.
one of my favorite nurse practitioners in women's health. And we have Debbie joining us from Menopause and three women that we have gut questions because there's a lot and you don't know what happens and why it's happening. And it's not a hot flash. So obviously it can't be menopause, right? It's not
Uh,
menopause. It's not a hot flash
Nothing's menopause, right?
thing, just a hot flash, just a hot flash. But we'll help, hopefully, that you understand why you can't eat what you did back in your 20s and 30s, how you can't eat it now. Well, you can, it
You
just won't
can.
be okay. You can. You can. You'll digest it 3 weeks from now, but it should be good.
Yeah.
I think I'm digesting stuff still from Memorial Day, but it's here nor there. It's here nor there. So, we figured that we would do, breaking the silence around just the menopause symptoms because not many people know about it. So, you feel like your stomach has changed and figured, "Hey, what can you tell us? Why is it changing, and what are some of the symptoms?" I know Debbie has some questions too, so
Yeah.
what do you got for us, Giselle?
So everything starts in the gut, right? There's so much and Mary, I always squirrel. I'm gonna try to stay as focused as possible. But when we have a topic like this, there's a lot
Yeah,
of different variables that can play
right,
into it.
right.
Just like just like any other organ system, right? Our gut is actually hormonally mediated. And so as we get older, we start to have symptoms, not just hot flashes, night sweats, sleep disturbances, mood changes, but we also notice that we start to get some common complaints of bloating. Why do I look 6 months pregnant? I'm so constipated, like, I don't know what's going on. All of a sudden, I can't eat foods that I once used to eat and had no problem. Um, some patients may say, "Man, my reflux is worse than it used to be," or, "I've always had IBS, but now it's worse," or change in appetite. Um, a lot of times, what providers when women go to their providers, they're put off or they're like, "Oh, it's just part of aging," or um they don't connect the dots. Like I've said in a previous podcast, is we have women come to the providers and we look at their age, we look at the symptoms, and instead of saying, "Hey, um could it be hormonally related?" We send patients to all these ologists to try to connect the dots for us, right?
Okay.
Um, and I was just thinking about this the other day. Hormones play such a huge role in everything in our bodies, right? I mean, think about it. Thyroid is a hormone, right? When that's off, we fix that or we try to regulate that, right?
Right.
Knowing that we have, as women, we have estrogen and progesterone and testosterone receptor sites all over our body, why aren't we more proactive in trying to change that or fix that, right?
Right.
We always go to, "Oh, well, must be thyroid. Oh, nope, thyroid's good. We're check." Um, but we don't look at the other things like
Right.
estrogen, progesterone, testosterone. Forget testosterone. Are you kidding me? Most providers that you go to, they're like, "That's a male hormone." But testosterone is actually one of my favorite hormones. But
I finally
looking at
got it. I finally got it.
I'm just
good,
starting it.
Yeah,
good.
finally.
We
It's so
well, we can have a whole
I
topic
call
on.
him my favorite tea.
I love it. I love it. We can have a whole topic on testosterone, you know that.
Oh, and we will, because let me tell you, it needs to be, I mean, the tea needs to be given the credit that it
Absolutely.
deserves because it really is. a hormone that's, one of my fave, but
Yeah,
there we go,
yeah,
down a rabbit hole. Here we go. So
down the rabbit hole, down the rabbit hole. But, when we so going back to a missing piece in women's health care, gut health is one of those missing pieces. Um, Again, everything starts in the gut. Our gut's
mhm.
responsible for so much. It is the hormone dependent organ. It's lined with estrogen, progesterone receptors throughout the entire GI tract, even testosterone receptors. Um, Hormonal influence, when we start having declines in estrogen, progesterone, testosterone, we're going to see a decrease in motility, right? All of a sudden, we're like, hmm, things aren't moving the way they should.
Right.
I'm feeling bloated. Um, the microbiome of the gut completely changes. Inflammation starts to take place.
Oh, yeah, inflammation, that lovely.
That lovely word, right?
Mm,
90% of serotonin is made in our gut. So if our gut's off, our serotonin's off. What's going to happen to our mood? Have you ever noticed that, like, if somebody's gut is like not right, it's almost, I don't want to say the Eeyore effect, but they're just like, think about it. Thyroid. When your thyroid's off, motility's down, depression's up, constipate. It's a hormone, just
yeah.
like estrogen, progesterone, and testosterone. So that's going to affect serotonin. Go ahead, Deb.
No, so it's very interesting you would say that. I have been dealing with gut issues my whole life, like my whole life. And I actually had hysterectomy, forced one really early on. And so I felt like all of my hormones were gone in a day. Everything was gone, and nobody really talked about how to fix that or what to do. So as life goes on, and you're all of a sudden saying, "Oh, I can't eat," like you were talking about, "I can't eat this, I can't eat that." And then each year as I get older, I'm in my 60s now, I'm like, I can't eat anything. Where I
Right.
used to be able to eat that pizza, and everything I eat now literally bloats me, gives me gas. And I'm starting to take the hormones now. So I'm hoping, I don't know if that's gonna help or not, but I feel like like you said, nobody talks about that. Like nobody says, like when you go in saying, I can't eat this, I can't eat that, or I'm exhausted, or I'm anxious, or
Yeah.
nobody's ever said to me, do you think we should check your hormones? It's always, you have to go get this other test, and you get a colonoscopy, and they put you through all this stuff where you're spending all this money and time. And if somebody may have just said, can we do a lab test and check your hormones, they may have said, you have no progesterone, you have no estrogen, and no testosterone. Hmm.
Well,
So what do you suggest if someone is like me and they're going to the doctor over and over again, and how do you even bring up that conversation so you don't feel like you're insulting the doctor?
no, absolutely. Okay, so and I just saw something today. I forgot where did I it was I forgot which doctor it was. She's an OBGYN, she had breast cancer, and she posted something about surgical menopause, right? And the minute that you have your ovaries taken out, you are in menopause. Those Your hormones are gone. Okay, maybe our adrenal glands pump out just a little bit of estrogen there, here and there, but the minute you take, it's female castration.
Yeah.
Your ovaries are
Yes.
gone.
That sounds really horrible. It just
When you
sounds
put it that way,
disgusting
it sounds disgusting.
that they
The
just did
problem
that.
Yes, the problem is, do you know how many providers do not have a conversation with their patients saying, "Hey, listen, we are going," how many surgeons? Um, we're gonna do this hysterectomy, and we're gonna take out your ovaries. Do you think part of that treatment plan consists of hormone replacement therapy
No,
post-op? Not one.
no.
Why not? It has to be, because we know that women are, again, we know that estrogen, brain health, bone health, gut health, cardiovascular health, all of that is protectant with estrogen, right?
Hmm.
This is the rabbit hole. So,
Yeah.
um,
Oh,
so, so when we take estrogen away, when we take those hormones away, we're taking all of those protective properties away from that patient, right? Um, I have so many women who have not had hormone replacement therapy for years, years. And I say, okay, well, when was your last bone scan, your bone density scan? Oh, I haven't had one because I'm not 65.
Yeah.
Guidelines say 5-year post-menopause. Okay. I hate the word guidelines because it puts medicine in a box. We should be able to be free thinkers as providers, and we should be able to come to a decision with the patient who's the CEO of their healthcare,
Hmm.
come up with plans with for our patients to say, hey, okay, look, we're gonna start you on hormone replacement therapy after your hysterectomy. We're gonna do a DEXA scan 2 years, 5 years post-op. We're gonna, you know, all these things need to be laid out. um, Knowing how these hormones affect every organ system in our body, especially gut health, that should be brought up too. And unfortunately, it's not. So I always tell patients, I will be their number one cheerleader, their number one advocate. There's times, obviously, that if they come to me for care, yes, I can order labs and DEXA
Yeah.
scans and blood work and all this stuff, but I can't do a colonoscopy on them or do, all the preventative other things. That's when I tell patients, you have got to tell your provider, this is what I want. And if they say insurance won't cover it, or if they say, well, we're going to get kickback, say, well, let's try it. It does not hurt to try. It depends on how things are worded. If you can speak for that treatment that you're going to offer that patient, then it should be allowed, right?
Right.
Um, but I wish and I hope that now more and more is going to come out, right? For proper treatment of women, especially women who are having, bilateral or salpingectomies with oophorectomies, or
Yeah.
removal of the tubes with the ovaries, right? That needs to absolutely be discussed and part of the plan. And I'm not bashing men by no means. You know, but if a man goes in with prostate cancer, right? They talk about treatment options for prostate and they talk about treatment options for ED.
Yeah.
Okay.
Yeah.
Why are we not talking about treatment options for women post hysterectomy with bilateral oophorectomies?
Do you know what I think? I just talked to a woman that is young. She's having a hysterectomy, and I think it's because the age. They think, oh, you're fine. You're young. I know that we're taking your ovaries and your uterus and everything, but you're not even anywhere near menopause. Like, I think that literally they take away the fact that they're removing everything that is helping
Yeah.
them with their hormones. But they look at them and they're like, you're only 35, you're only 32, or whatever. And and I told her, I was like, please make sure you ask for hormone replacement. And she was
Yeah.
like, oh, yeah, they didn't mention anything.
Of course they didn't.
Please, please ask for that. And she was like, okay, Mare, thanks. I'm like,
Estrogen, progesterone, and testosterone. And
yeah,
she'll get kickback because most providers will also say, you've had a hysterectomy, you don't need progesterone.
right.
Progesterone's
Debbie.
just
Yeah.
important.
So I
Progesterone's
have
just
to, I got
important.
to tell you that is exactly the case. I am now getting hormone therapy. And when I told my story to my gal, she literally like looked at me like, how are you even alive? Like, how
Yeah.
did you go all, I'm 60, going to be 67. And I'm like, I'm still having all these symptoms. And she said, I don't know why nobody ever talked to you about it and what you need to do. And I am now, like I say, I'm just starting. It's only been less than a month, so I'm still adjusting, but
Yeah.
I honestly feel like the whole when we're talking about the bloating and the constipation and the food sensitivities and the acid reflux, I mean, I literally had a TIF procedure because my acid reflux was so bad.
Yeah.
So, and I went to doctors and doctors, they're like, why am I coughing? Why am I this? And they're like, oh, they just kept doing more and more tests, and now that I've had the tip procedure, it's definitely better, but I feel like if we could have these conversations, like you're saying, with our healthcare, um, providers, we can we can give them, "This is my symptoms." Like, "These are my symptoms, and how can we help them? Is it my hormones? Is it my gut? What is it?" And the whole gut thing, I'm still struggling with gut, and I haven't my son does too. So I really feel like we don't talk about the gut. So I'm really glad you're doing it
No.
because
Yeah.
it's
Yeah.
pretty sad when you can't when you even eat, like, a piece of chicken and go, "Now I can't even have chicken." Jeez Louise, what am I gonna eat? I
Yeah.
can have rice my whole life? You know, is
Yeah, which is full of carbs, and it's like, okay, now our blood
and
sugar is
potatoes and
rising.
pasta.
Yeah.
Yes. Yeah.
Yeah.
And
That's what
that's
I
the whole
live
thing.
on.
Yeah, like, when I was trying to cut things back, I was telling Debbie, I was left with lentils, which
Yeah.
I have not had a lentil since I started doing the fiber and everything, and I'm fine with that because when I said to my husband, I'm like, "I can make Salisbury steak with lentils," and he said, "I'm gonna need you to back away from that oven. I'm gonna need you to back away. I don't want another lentil thing," and I was like, "I'm so sorry, I don't know," and he's like, "Lentils?" Because he would make it, and I'm like, I didn't even know what a lentil was in my
Yeah.
20s and 30s, but like you do, like you said, you cut everything out until you are literally down to like maybe 3 things, and then that's all you eat. And you hope that you don't get bloated or you're at work and then you have to go to the bathroom. It's
Yeah.
like this whole thing, instead of just being open and honest and being like, yeah, I don't feel good today because my gut's off. People will walk around like Eeyore and just be like, I just don't feel good, but I don't really want to say why. And that's the
Well,
sadness of it.
and again, I think it's because we don't put the emphasis on, hey, we got to start listening to our body. I have some patients who are so in tune with their body. They're like, I know. And I'm like, this is amazing. Like, this is
Yeah.
amazing. Right.
Yeah.
Um, I had a patient who had a hysterectomy at the age of 35.
Mhm.
She is now 43. Her bone health, she's osteopenic. So she has osteoporosis, right? Excuse me, not
Mhm.
osteopenic. She's osteoporotic. Um, she is, she has, her cognition is off. Her cardiovascular health is off. So I'm working on all these things with her. Um, she was not put on hormones. She was not put on hormones. And so I have her on estrogen, progesterone, and testosterone.
Yeah.
Testosterone is just as important as estrogen, especially when it comes to bone health.
Yeah.
So they never did a bone density scan on her until she met with me, and then she went and demanded it. Um so now what we're doing is we're doing the hormone therapy. We're getting her gut right. I'm looking at her as a whole person,
Right.
not just as
Right.
one system. And it's going to take time. And that's what I tell patients all the time when we go through something like this. It's a marathon and not a sprint. Um, but we will definitely get there. Now, um, I had another gal come to me, poor thing, young girl, young. She's early 20s, and she's like, I don't know what's going on. My gut's completely off. I keep on getting yeast infections. So we're doing GI mapping on her. I ordered a GI map, and she was emailing me. She goes, "Do I have to do a complete elimination diet?" And I have one patient who was seeing another provider. she I talked to her last 2 weeks ago, and she's miserable. She goes, "I can't eat potatoes anymore. I can't eat green beans anymore because they told me I can't." And I said, "You can. You just you don't need to eliminate everything. We just need to
Right.
work on healing the gut. And there's ways that we can do that with supplements, with food, with fiber, with we
Yeah.
don't need to get rid of everything. Now, obviously, um there are some foods that maybe are a no-go, but it doesn't mean that you have to stop everything, right?
Yeah.
Um, but
So quick question for those of us who may not know. When you say GI mapping, what do you mean by that?
so it's a specific test. It's a little bit pricey. Most insurances don't cover it. Um, but it's where you get a stool sample, right? And you send it in, and they check your stool for bacteria, viruses, yeast. They check for leaky gut, right? So there's different things that we can add on. But it gives you a whole roadmap, right?
Yeah.
Of what could possibly be going on in your gut. And so If there's a certain type of bacteria that nobody's ever looked for, then we treat that bacteria based off of the antibiotic that we know is going to work for that if it's needed, right? Now we start talking about antibiotics and gut health, and we're like, oh, that disrupts everything. Sometimes it's needed. However, if it's treated properly, you can help prevent secondary issues from the antibiotics, right?
Right.
Um, but again, there's other supplements that can be done. We can check for the testing portion of it, right? GI mapping, which is something. But if we're like, I don't know, maybe I don't want to do the maybe I don't want to do the GI mapping right now. Maybe we can do like the breath test for SIBO, which is
Mm.
slow growth bacteria and yeast. So
Mhm.
um there's so many there's so many different things that we can look at and
That it's
figure
really
out.
interesting that you say that. I mean, I did not know about the GI mapping, and then you said about the breath test. I mean,
SIBO.
is there like, what would be when you first start feeling all of this, what would you suggest would be the first thing they would do or say to their doctor? Like, how would you say, "This is what I'm feeling. I've been feeling this. What can I do? What do you have? What's the easiest way to take step 1 to recover or to find out what the issue is?"
So I would definitely um look at so you're going to need to get testing done, right?
Mhm.
So blood work, we can always do blood work to check inflammatory markers, right?
Mhm.
We can do the SIBO breath test, see if that gives us any information. And then if not, then go on to GI mapping, right? Now, if we have a patient who listening to the patient, getting the patient's history, getting their family history is important because never do we want to miss something thinking it's gut when in fact it could be ovarian, right?
Right. That was the
Or
other thing. Like, how do you know, like,
yeah,
when this is not just a gut thing?
yeah. Well, and that's the thing. Like we have to put our investigator hats on
Mhm.
and see what blood tests tell us, um what other diagnostics tell us, like an ultrasound. If I have a
Mhm.
young lady and there's a strong family history of some sort of reproductive cancer, oh, you have pelvic pain? Let's go. We're going to get you an ultrasound just to make sure everything looks okay, right?
Right.
Um uh, if everything's clear, beautiful. You know, start thinking about other secondary things such as, and we have to go down that pathway, is it possible that maybe there's some sort of underlying malignant, not just
Mhm.
ovarian, but colon, right? Let's get that family history. So really listening to the patient, getting the family history is imperative. If they're starting to have, you know, weight loss for no specific reason, like they can't keep weight in or on, okay, yeah,
Yeah.
now I'm going to start being a little bit more aggressive with my testing and trying to figure out what's going on. And then sending patients um to the proper professional,
Yeah.
right? Um, to do a little bit further investigation. But going back to the basis of all of this is getting that history, finding out what the patient is on, hormones, non-hormones,
Right.
um, what their diet's like. I mean, let's be honest, the Western diet is not good, right? Like it's not good. It's full of processed foods. It's um even when we think we're trying to eat organic, it's not really organic because, maybe the farm up the street uses
Exactly.
pesticides and it runs down. And so it's
Works
just,
downhill.
And even
yeah. So there's a lot that goes into it, right? And whenever I counsel patients on proper nutrition and exercise, I always tell them it's a full-time job, y'all. It is a full-time job getting protein, getting fiber in. I don't lie to my patients. I cheat my way through my fiber. But getting the proper fiber in. But really having a patient listen to their body, right? Um, understand the symptoms that they're having
Mhm.
and writing those down and having that conversation with their provider to say, hey, what really is happening, right? A lot of times, when we have those when we have those hormone fluctuations or the decline in hormones, all these systems are disrupted, you know, all at the same time. And so it can be very confusing, and we feel like it's something psychological when in fact it's something physiological that we can fix.
Yeah.
Um and so really understanding the roles of these hormones like estrogen, which is the anti-inflammatory protector. Um, it's profoundly anti-inflammatory, especially
Mm.
in the gut. When our levels are good, when we have high levels of hormones. I mean, think about when we were in our 20s. We were like, oh, we had, everything was great. Sex drive was great, gut health was great, vitality, like we had it all, right? Um, but
Let's pause for a moment and just, yeah, that was great. I wish I knew how great that was. I would have really treated my hormones a lot better. I don't know.
well,
Something.
but I mean, we always have to give ourselves some grace, right? Because again, I think really the only hormone that most providers are like, okay, if it's off, we got to treat. And I hope I don't get any slack from that. This is not how I mean it. But, thyroids are
Yeah.
it's part of the endocrine system, just like our pituitary, our ovaries,
Yep.
testes in men. Um, so if, if your thyroid's off, you're going to get treated, right? Why aren't we thinking the same way about estrogen, progesterone, and testosterone?
Yeah.
It's
Well,
not a
it's
bad word.
no,
Hormones are
it's
not a
not.
bad word. Yeah.
No, it's not. And with that whole GI mapping, you're the second person I've heard say that. I never heard, and I'm also a nurse, never heard of GI mapping. And I actually got it done because I started with this website to help like get protein and it's like for women's health.
Hmm.
And they were like, "You're gonna go." It was a dietitian. She was like, "You're gonna go GI mapping," and I was like, "First of all, I don't even know what that is. I've had
Right.
numerous colonoscopies, right? Because that's the easy thing. Let's
Right.
that let's have that prep for 12 hours and then go that." Had I
Yeah.
known the GI mapping, so much easier. You just send in a sample, and then it takes a few weeks, but it was amazing. Like I was like, "Wow, I have all of that going on." In my gut. And then there is, you could take an antibiotic or you could try the supplement way, which I'm trying to I guess cure it or heal it per
Yeah.
se. Because
And
it's
there's
just the
different pillars, and I'll get into the different pillars, but so by no means does GI mapping replace a colonoscopy,
oh
but
no.
it gives us that the profile of,
Yeah.
by DNA,
Yeah.
gastrointestinal profile, bacteria, the metabolic profile. There's just a lot of information. I always tell patients knowledge is power, right? Like
Mhm.
when I have patients who are like, well, my provider won't run labs for me because they say, well, yeah, I can tell you what your hormone levels are if you're postmenopausal with no ovaries or even postmenopausal with ovaries not on hormone replacement therapy. I can tell you that. But let's get
Yeah.
baseline and see. And then if we start treatment, we can always repeat and see where you've gone. It's kind of like having a sticker, right? Like, oh my gosh, your hormone levels have increased. You're doing better,
Yeah. Yeah.
So
Yeah.
it's always good for patients to see that because then they know where they're at. Now, I have patients I have patients who know their body so well that they're like, I feel better when my estrogen level is at 80 or 90.
Mm. Wow.
Okay.
Wow.
So let's try and figure this one out. Right.
Yeah.
But, because our, hormones still fluctuate. But, at this point, having estrogen on board and progesterone on board and testosterone on board are beneficial for us.
Yeah.
You know, um, when our estrogen levels are healthy or at a good spot, that helps support our gut motility, um, the mucosal barrier of the gut. It helps maintain that. Um, I wish I had slideshows. So
Mm.
in our gut, there's junction points, right?
Mhm.
And so it helps support those junction points and strengthen those. So that way they don't start to separate. And then we have leaky gut, right? Where it's like leaky guts when we just feel absolutely horrible. We have
Yes.
worse symptoms. Um, the estrogen helps support that microbiome and the diversity of the good bacteria in our gut. And it also helps with our serotonin, right? Um, Again, going back to when our estrogen drops, that's when we have that slower motility, that
Mhm.
inflammation, more inflammation. We have increased constipation and bloating, food sensitivities. The other key component that we have is that this is a funny word. It's estrobolome, which is the gut bacteria that helps metabolize estrogen. And so when that gets disrupted, then everything just goes chaotic, right? So
Yeah.
like Deb said, man, I'm having these gut issues. I'm having this reflux. I'm having, I can't even like what you said, Mare, I can eat, three things and
Yeah.
that's it. And how much longer are you going to be able to eat those three things before, you know,
Right. Right. You're
yeah,
down to water and then you still bloat. You're like, that's
yeah,
great. That's great.
yeah, yeah. Well, and we always think this is why, you know, when we start talking about women who have had hysterectomies, um, and they don't get progesterone is just as important. It's the
Mhm.
immune modulator, right? So it actually, it actually helps support the immune responses in our body. So when we have good levels of progesterone, it helps decrease those inflammatory cytokines like TNF. I'm not going to go into all of those, but it helps decrease those inflammatory markers. It helps increase the anti-inflammatory um, interleukin 10. It stabilizes mast cell. Now, mast cell is one of the things that I like to talk about because a lot of times there's still a lot out there that we don't understand about mast cell activation syndrome, and it can be hormonally related as well. Um, Estrogen typically can increase histamines. Progesterone helps decrease histamines. What's mast cell activation? It's a histamine response, right? So we need to bring in that progesterone to
All
kind of
right.
help regulate that.
Right.
So progesterone not only is the the bodyguard of the uterus, and it also helps with sleep and mood, but it's also our immune modulator that most patients don't, and most providers really don't think
Right.
about. So,
Debbie, I'm so excited that Debbie finally is starting them because now she'll
yeah,
be able to see how she felt without them all these years and then
yeah,
how she'll feel with them all these years
yeah,
moving forward.
and I'm hopeful, right? Did they put you on progesterone, Deb?
I just started it,
Okay,
but
good.
when before my hysterectomy, I had a lot of infertility issues. And I was short on progesterone, so I couldn't carry my son. So I had to get shots like all the time. So
17
I was able,
hydroxyprogesterone. Those things are thick too.
and yeah, so I had those for 8 months of my pregnancy, bedridden. So I already know that I didn't have enough progesterone from day one, even
Yeah.
before that. But then after the hysterectomy, when I said, oh, they're like, you could take this, but they also threw out, well, if you have history of breast cancer in your family, so we're taking you off estrogen. And oh my gosh, you want to be really hairy? You can't take, mind you, I'm 30 something years old and you're telling me I'm going to become a gorilla? Like, I don't want to take
Yeah.
that shit, you know? So I feel like we were back then, as they say, the black box and all that. It was so unfair to any of us to even have that
Yeah.
conversation to say, you know what? Let me be honest with you. You're really not going to do this. Or if you don't do this, your bone health. Like I didn't get my first bone scan till what was the age you can get it? 50 something? What
65.
65.
oh well, actually I did get earlier because of all my stuff, but I was probably like 45, 50 when I got my first one and it was already destroyed. It's already bad and it's really bad now. And I've fallen twice and I broke bones, and I'm thinking, "Wow, what is up with me?" And,
It's because of the
I'm
hormones. Yeah.
hoping I have faith now that I'm on a plan,
Yes.
that it will be much better. But I want to go back to where I know it's kind of a weird topic. I don't want to forget it. We were talking about, I know it's embarrassing, constipation and stuff like that. I know that it's really a big deal. I mean, when you have all that stuff in your gut and you feel like your whole world's ending. You're depressed, you don't want to move, you have cramps, and you don't go places. You have to pick restrooms that are close by. And is there a way, or is there a certain, like, I can't take a lot of fiber. It makes it worse for me. I don't know why. But is there a way that you could tell our listeners, like, what would be something good, or when they're traveling, what can we take so we don't ruin our whole trips and our days with
Yeah.
feeling like, oh my gosh, I can't go to the bathroom, and you're just getting more and more bloated. So
Yeah.
how do you
Right.
help
And
that?
it does go to your mind then, because then that's all you can think of. You're like, "Oh my god, I have to go to the bathroom.
No,
I can't
as
go to
you
the
know,
bathroom."
I joke about it. I'm like,
Right.
I'm on potty watch with people. Okay, you're on day 5. Okay, have you gone? Nope, nope. And that
Yeah.
could be really bad. But I feel like if we can get the conversation out there, you wouldn't be embarrassed to say to your doctor or to say to your girlfriend, hey, do you have, like, what are you doing?
Yeah.
And we need
And
to have that conversation.
absolutely. So when I talk about helping patients, okay, so here's a nuance going back to progesterone. So progesterone, and I just want to say this because I've had some patients who are like, well, I don't understand. Like I take progesterone and it just made it worse for me. So um progesterone helps relax the smooth muscle in the gut. So it can actually
Mm.
cause constipation. So when we think about, I know it's one of those things we're like, how is that even fair? Right. But so when we think about pregnancy, when we're pregnant, right? Progesterone high, women are constipated, right?
Mhm.
The luteal phase of our cycle that that causes um that can cause most women have in their luteal phase constipation, and they're like, I don't understand why. It's because of the progesterone, right?
Mm.
Oh,
So yeah. So how do we help women? And you're right, it's not just about one treatment. We really I like to think about it as pillars, right? Going back to the bloating, when we have decreased motility and that food sits in there, and I know that I said it, um it starts to ferment, right? So the bacteria causes that food that's in our gut to ferment, and so it produces methane gas, hydrogen gas. We have the bloating. We're like, oh my god, what is I feel like I'm a dude now because, like, I have all this gas and it's just
yeah,
horrible, right?
yeah.
Yes.
So um what do we do? Well, obviously, fermented foods actually help. It's not the same thing as fermentation that happens in the gut, but fermented foods actually help with gut health and bloating and constipation. And I know that that sounds crazy, but it can help reduce inflammation, it can improve motility, it can strengthen that gut lining, and it also helps support estrogen. So those the fermented foods are actually pre-digested almost in a way,
Wow.
um, and so it helps break down sugars and fibers a lot a lot easier and better. Now, women who have SIBO, which is the small intestinal bacteria overgrowth, um, or who have histamine intolerance, or even mast cell activation, the they may not tolerate the fermented foods because of the inflammation. So once inflammation and motility improve, then that can help with the bloating if you use fermented foods. Now, when I treat a patient, and this is a long answer to your question, sorry. I look at restoring motility, rebalancing the microbiome, reducing inflammation, healing the gut and the lining, and then obviously support liver and estrogen metabolism, and then obviously addressing any hormonal imbalances. So this is where, doing blood tests can be beneficial. Whenever we check for like a high sensitivity CRP, that's not specific to anything, right? It's generalized inflammation. Okay, well, we know we have generalized inflammation, but if my patient's having bloating and gas and blah, 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 oh, well, then maybe their gut is inflamed and that's where
Yeah.
it's coming from, right? So, um, really getting and going back to the to the conversation with the patient, we can eliminate things to see if that makes it better. What I have found is most patients who do a full diet elimination are miserable. They're not
Yeah.
happy. They're
Yeah.
they're like, I can't enjoy. My one patient, she's like, I had to bring vegan meatballs. What is that? She
Yeah.
goes, there's no vegan
Lentils.
meatballs.
Yeah.
Yeah.
No, there's
Yeah.
nothing. You eat things that are gray. They're gray. It's
They're-
not even on the food chart. It's like gray matter. And you're like, oh, okay, but it's dairy free, gluten free, all of
right.
this free, taste free. And then you're like, okay, but
Yeah.
it's hideous. Yeah.
So we want to try to restore that motility. How do we do that? We start
Which would
talking
help with the
about,
constipation. Yeah.
yeah, and so we start talking about like magnesium glycinate. Glycinate helps restore or balance hormones, and then citrate can help with the actual bowel. Now, magnesium, most of the population's deficient in magnesium, to tell you the truth. So looking at the supplement of magnesium, ginger, walking after meals is
Ginger.
important.
I love ginger.
I
Yeah,
love ginger
ginger is
too.
so good. Oh God, I love it.
Ginger's amazing. Abdominal massages. I know, like when I tell
Mm.
people this, they're like, "What?" I'm like, "Lay down and learn how to just like palpate your stomach. That's going to help increase motility. It's going to help with peristalsis in the gut, right?"
Does
Um,
castor oil, have you heard about castor oil on the abdomen
mhm.
to help?
Does that
Does
really work?
Castor oil pads.
Yeah, I got
I've had
castor oil.
patients. I've had
Have you tried
patients.
it?
Yes, I have. It's thick as anything. Like it's in a dropper, and I have it on my bedside
Does
table
it
along with the magnesium cream. And dear God, I mean, it's barely enough room for my phone on there, but I do put that on there and massage it into my stomach nightly.
So
is it
you can get pads. They're
Maybe I should get
called
that instead.
castor oil pads, and you can infuse it or put the castor oil on there and lay on it with your
That
stomach.
might be good.
Now,
does
there's
it
right.
smell? Does it smell?
Mm-mm.
No.
No, it doesn't.
Hmm.
Now, I am going to tell you, right? There are a lot of therapies that may be unconventional or interventions that may be unconventional, right? Because the medical societies don't recognize them. But um I always tell patients, I'm like, yes, I love to look at research. I love to see what what works and what doesn't. Um, but I also have patients who are like, look, this stuff didn't work for me. This is what I tried and this worked.
Yeah.
Okay, well, let's try it. Let's continue. Why wouldn't we? Right? If it's
Right.
not causing you any harm, if you are not having any side effects from it, if you are doing well, let's continue on and see what happens. Um, but castor oil, yeah, can help. Um, uh, Now pelvic floor therapy, we underuse pelvic
Yeah.
floor therapists here. There's a lot of stuff that can functionally be fixed with pelvic floor therapy. You would be surprised. There's a lot of women who are walking around with like hypertonic pelvic floor dysfunction and they don't even know it because we're told Kegels, Kegels, Kegels. Okay, well, the pelvic floor is a muscle, just like
Yeah.
anything, right? And
Yeah.
if you're concentrating on Kegels, well, you may be building muscles up here when in fact it's the muscles down here that need to be worked
Right.
at that we're not paying
Hmm.
attention to, right? So
Mhm.
um I love pelvic floor therapists. They're amazing. And I think it's more and more coming out. Um, more and more are coming into that that specialty.
Fields. Yeah.
So
Yeah.
it can help for sure. Um, Another thing, and I know some patients may not agree or may not like it, but um, hydrocolonics, those help. Getting in
No,
there,
what
it's
is that?
so
Is
it's
that
where you go to a provider, a therapist who sticks a tube in the rectum and it essentially flushes out, right?
Yeah.
It's like a roto
An
rooter,
enema.
if you
It's
will.
sort of
an
like
enema?
It's an
a
it's
water
a
It's
it's a
an
bottle.
enema.
fancy
Just
Yeah.
call it an
fancy
enema. That's
yeah.
that's what I grew up with it being called.
Yeah.
Like,
It's
that's for
it's a
me.
it's a fancy enema, if you will. But
Okay.
what they
Yeah.
do is they basically go in and flush out the intestines. They're doing abdominal massages. They're
Mhm.
really they're really focusing in on your gut, right? Um, there's been patients who have done that, and then we've got them started on all these supplements to really restore their gut health, and it's helped them.
So that, I mean, that I know it sounds kind of, ugh, to have it done, but I'm thinking there's times when your gut is so bad and you
Yeah.
feel so
Yeah.
bloated for so many months. You're like, how's that ever going to get cleaned out? Like, I mean,
Right.
Right.
And it's
honestly,
sort of
Yeah.
doing this, like you said, it sort of like takes you back down to like
that would
nothing.
be
So then you start with like the magnesium, the ginger, anything else that you would start with to sort of like like a probiotic. Would you do a
So
probiotic?
so probiotics are good, right? So this is just like restoring motility,
Yeah.
right?
Right.
Correcting hormone deficiencies. Now to rebalance that microbiome, that's when we're going to start looking at like the fermented foods, right?
Oh, the fermented foods. Okay.
Um, and
Kombucha,
then
does that
fermented. What
work?
are you talking, sauerkraut or something
yeah,
fermented?
yeah,
Okay.
sauerkraut, uh,
Kombucha, does that help?
kombu-
Okay.
yep,
That you can
yep,
drink. It's
that you can drink.
I mean, it's very
Okay.
Um,
algae to the sea, but I do drink that sometimes too. I mean,
Yeah,
it's
but those types of foods help, right? Certain red wines. I'm not promoting alcohol, but
there we go, Debbie. She's
it's
talking our language now. Thank you.
listen,
More talking
it's
my language,
fermented.
but I also, if I have too much alcohol or there's
Right.
certain wines that
I
actually
know.
clog my nose up, number one, but
It's
they
a histamine
also,
It's
response.
a
I
histamine.
also
Yeah.
get a gut. Sometimes my gut is worse when
Yep.
I have wine. It's
And
like,
Yes.
what
sleep
just
and
happened?
everything. Yeah.
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 And
So
so it really is you have to again, I'm not saying start with red wine and we have to get that gut restored and then we can start introducing
Yeah.
like red wines again. But we in including the fermented foods can definitely help. Um, Restoring that microbiome again, strain specific probiotics, right? So lactobacilli, I can never say bif bifid bifidolactobacilli. I can never
oh,
say that. Sorry.
that's a
Yeah,
big word.
it is a big word. But those types of foods, right, can really or probiotics can help restore that gut, bring in the good microbiome, the good bacteria. Yogurt's another one. Yogurt's another good um, fermented food. So like Greek
Oh,
yogurt, if you're going to do anything, do a
But
Greek
it's
gosh, I
yogurt.
didn't
also,
consider that fermented. That's interesting. I
Yeah,
like
it,
yogurt.
but
yogurt's really good.
if you're lactose intolerant, I can't
Yeah,
do yogurt. It's like you're trying to get your bio
So,
stuff. You're
yes,
trying,
yeah,
you're
I
trying to
think
get your protein. You're trying to get your fiber. I'm trying to get my calcium, and all the
yeah,
foods that help that are all the foods that give me that my
yeah,
gut does
that
not
your
like.
gut can't handle.
Yeah,
Restoring your gut's gonna
yeah.
hopefully be able to help you eat those foods again. Um,
I can
uh,
tell you honestly because
Fermented
that's how
soybean.
I couldn't do a lot, and then just restoring it and getting it back, like, I can within moderation, like I'm not having yogurt every day, but you can have a little bit and it not affect you like it did before. So it is all like you said, you have to get the GI system healthy
under
again.
control first. Yeah.
Yeah.
Kimchi is another one.
Yeah.
Natto, natto, which is like fermented soybean, is another one.
Hmm.
Um, Pickles, olives.
I could do pickles and olives.
Oh my God, I could do them all day. I am good with that now. Let's
Yeah.
take away Greek
I am gonna
yogurt.
go grab a pickle pretty soon.
There you go. See,
I'm gonna
so
go eat a
pickles are good.
pickle. I
Uh,
actually have pickles in my refrigerator. I don't have much else, but I do have a pickle.
See,
Yeah,
there you go. Kefir's one. Um,
that's dairy, though.
that
I
is
think
dairy.
I don't. Yeah.
Tempeh, which is I think soy again.
Mm,
So those types of things that are fermented, you can use those for your gut, to help get that going. Um, there's some gentle prebiotic fibers like sun fiber that can
Mm,
be beneficial, right? Um, and then we look at reducing that inflammation. Now, um, if we're just going off of supplements and foods, then we want to make sure we're focusing on fatty omega-3s. Now,
mhm,
some say 1,000 milligrams. You can do 2,000 milligrams of fatty omega-3s. And not only is that going to help your cardiovascular health, it's going to
mm.
help your gut health. It's going to, we don't put too much emphasis on fatty omega-3s as we should. So obviously, like if you're not eating a lot of fish, you can supplement. You can get a good fatty omega-3 supplement, make sure it has a good
mhm,
DHA and EPA content in it that helps with
mhm,
brain and cardiovascular health, but that can help with inflammation. Um, Turmeric
Mm.
turmeric is a
Yeah.
good one. Um, Polyphenols, which are the plant-based compounds that really
mhm.
have the anti-inflammatory um, components. Avoiding seed oils and processed foods, which I mean,
Yeah.
obviously you're like, hey, listen, I'm already down to, you know, I'm
Yeah. Well,
already down to three
yeah.
foods.
So with
Yeah.
the whole gut issue, fast food is a killer.
Oh yeah, I'm
Yeah.
I
sure.
mean,
I'm
and
sure.
sometimes you just crave it. And I've been where I've like
And
driven
then when you eat
around
it,
the
you're
block
like,
twice,
Yeah.
just like,
Yeah.
here's a Jack
You
in the
feel
Box.
horrible.
Oh, nope, nope. Oh, here's a Burger King. I could do this. I can do this. And
yeah,
then if I give in to my whatever it is, I pull in, I get it, and I have within 10 minutes, I'm like, what the heck did I do?
yep.
Right.
But it's
I've
it's
done
like
that.
a psychological thing. Like every now and then you just crave, or you crave ice cream, or you crave things that you know are going to hurt your gut. So I just wish there was a simple way that we could tell I mean, I know it's easy to say, oh, you're going to eat that, you're going to get a stomach ache.
Yeah.
Yeah, it's easy to say, but there's times when you just feel so crappy because you already feel crappy. Like, oh, well,
Yeah.
I'm just going to have more crap to make me crap.
It's
You know?
because we have that it's because we have that reward center.
So how
And
do
that
we like
reward
fix that?
center is like and truth be told, you know, people might not like this, but a lot of times using a GLP-1 can help reduce that reward center. However, increasing your fiber can help reduce that reward
Yeah.
center though too, because that increases natural GLP-1 in your gut. So, and I'll get into the fiber in just a second, but
Well,
it can
that's what
really,
when you said about the fiber, I need to now know how you said you cheat on your
I
fiber.
want to know that too.
I
oh,
want to
I'll
know
give
how
you,
you cheat on it because I'm like, I'm
I hate
willing.
fiber.
I do.
Yeah.
I do that sun fiber. That sun fiber is actually the one that I take with the L-glutamine or
yeah,
whatever. What is it called?
glutathione. It's glutathione that you take, right?
Yeah,
Yeah.
probably.
Um,
Probably. The Jersey in me, God only knows. It's L with the thing. I was like,
or
I am
glutamine. It's glutamine that you take, I think.
I
L-glutamine.
think I don't know, it's a white powder. I don't know.
Yeah.
But it's that sun fiber.
I am
It's
with
that
you,
sun
Mara.
fiber that I take. Yeah.
I love it.
But how do you cheat on it?
Yeah.
Okay. So there's different foods obviously that have high fiber in it, right? Um so I try to look for foods that have protein and fiber. So beans, avocado, lentils. Um but we're done
Love
with
avocado.
We're
I'm done
Avocado's
with
an
it.
easy one. Yeah.
avocados
Yeah,
are
love
great, right?
avocados. Love it.
But beans are gassy, so it's like, what is it?
Beans can be gassy. If you put a potato in it when you cook it, it can take out that gas.
Oh,
Really?
very good. That is my
That
number one
is.
takeaway. Put a
That's
potato in beans when you cook it?
yeah. That's
Because
what
I do love beans, but yeah, you take it and I'm like, whoo, whoo, I need
you're
to be
all, this
alone
is
in
great.
my car
Put a potato
with
in
the
with
windows
beans.
down if I'm gonna do that.
You're all,
Yeah.
I feel the fermentation process happening. No, I'm just joking. So so I like and I don't have any endorsements. I don't endorse anybody. But things that I've learned, like the super seeds, right? So hemp,
Mhm.
there's one by Better Body Foods that I use, and it's called Super Seed, and it has flax, chia, and hemp. 3
Mm,
tablespoons of that gives you 6 grams of protein and 8 grams of fiber. So I make
that's
a
a lot
smoothie.
to put
Ah,
down.
But
you put it in the smoothie.
I make a smoothie. I also have a homemade fiber protein recipe that I can share with you
Please
guys.
share that with our cuz we need that.
Yeah, I'll share that with you guys in just a second. But um so I usually do like a base, right? Depending on how much protein I need. And sometimes I put Greek yogurt in there because it has Greek yogurt. A good Greek yogurt can give you at least 18 grams of protein. And then I do a base protein shake too. So I'm getting the protein. Um, I used to put, and I know some patients would say, oh my God, that sounds horrible. Putting half of an avocado in a
Mm,
smoothie makes it creamy. So not only does it make it creamy, but it gives you protein and fiber. It is so much easier to drink this
I
stuff than it is to
I
like
have
sit
heard that.
down and eat, right?
Yes, I
Uh,
agree.
yeah. And so there I always have a story. So this was probably about how old's my son now? So this was probably about 13 years ago. I remember sitting in a doctor's office and there was a magazine. I think it was Vogue. I typically don't read that stuff, but it was talking about Bobbi Brown, the makeup artist.
Oh,
And
yeah.
she's stunning, right? And it says, learn what she does for her overall health or whatnot. Um, and so I was reading, and a lot of it was gut health for her. And um, I was reading through it, and she kept on mentioning this high fiber diet or high fiber cereal. And I couldn't find the name for it. I was like, what the hell? Where's this damn fiber cereal? I
Yeah.
need to know what this is because I need to know. I need fiber. Um, it had in one serving, it has 23 grams of fiber. One serving is half of a cup. So I'm reading through it. They call me back and I'm like, look, can I take this magazine? Because I really need to figure out what this fiber cereal is. And they're like, the poor medical assistant thought I was crazy. So I take it back and I find the name of the cereal. And I thought it was a joke. And when I bought it, because it had to be ordered, my kids thought it was a joke and they almost threw it away.
What was it?
Poop like a champion.
What?
That is the name of the cereal. It's called Poop Like a Champion.
No. Is
I'm
it
writing that
still?
down. Is
Promise
it
you. And
still
it's still,
around?
yes, ma'am. And now they have different flavors. They have
Oh my
chocolate.
God.
But so it kind of reminded me of,
I'm
remember
Googling
grape
it right
nuts?
now.
You are so funny. I want you to
Effie is
Google it.
getting it.
I want you to Google it. So
I'm doing
it
it right
reminded
now.
me of, remember grape nuts? Grape nuts were like
Oh,
those,
yeah.
it kind of
Yes.
reminded me of that.
Oh
Um,
my gosh.
I
It's
don't know
real.
what, it is real. I don't know what cardboard tastes like, but I'm pretty sure that's like close to it.
Oh,
So I was like, I need to get this damn fiber in my body. I need
yeah.
fiber. So I used to put a whole serving, which was a half a cup, in my smoothie, but it made it kind of thick and it
Oh, yeah.
worked. Like I was like, oh my God, my gut, this is great. I was
I am
exercising. So then I was like, okay, I'm not going to do I'm not going to do the half a cup because
Yeah.
it makes it kind of thick. And then with the super seeds and everything, I'm like, maybe too much fiber. Like
Right.
as women, we need 25 to 35 grams of fiber a day. That's what
Okay.
we need. Okay.
I
So if we can at least get a minimum of 25 grams of fiber, we're good. If you can go up on that, by all
Okay,
means,
so their tagline, I just have to share. Well, it is poop like a champion, the highest fiber cereal that turns your number twos into a perfect 10.
listen,
I'm going to click order now.
I ordered that stuff. I ordered like 5 boxes, and my son, I remember, he's 19 now. He was like, is this some sort of joke? What is this?
They even have a capsule too. They have a capsule.
Yes, but I don't feel capsules are that effective. I
Yeah.
feel the
Get
cereal
the
would be more
cereal,
effective.
Debbie.
Yeah. And then
And I'll use
obviously
almond milk. I'll use almond milk to get my calcium.
you can use almond milk, yeah.
Yeah, there you go.
So
I can
so you use that
hardly-
as a base.
Yeah.
I know it sounds insane. So I do a quarter of a cup, which is still 11.5 grams, plus the 8 from the super seeds. That's 19. If I do half of an avocado, that's what, maybe 4, maybe 2, 4, right? So you're starting off pretty damn good with that fiber,
Yeah.
right?
Mm.
Now, everybody's like, oh yeah, I use Metamucil, blah, blah, blah. Metamucil is absolutely
That hurt.
horrible.
Yeah.
Yeah.
It has aspartame, it has junk
Yeah.
in it.
Yeah.
And again, I have no endorsements. I don't know, I don't have any endorsements. I just know what works for me. But there is
Hopefully,
a
Debbie
psyllium.
coming in 2
no,
weeks by the time she
No,
gets it.
they have a honey graham flavor.
Yes. They have the honey graham. I
Put it
take
on
them.
top of your
I get the plain because I put it in my smoothie.
Right.
That way I don't taste it. But with the it's a psyllium husk. It's called Consol,
I've heard
KONSYL.
of that.
Yeah. 1 teaspoon gives you 5 grams of fiber, right? So you can do that 3 times a day and get 15 grams. Like you can mix it in your water. You can mix it in your smoothie.
What was that? Spell that again.
Consol, KONSYL. So, using that type of fiber versus if you're using Metamucil, you're using 2 tablespoons to get 6 grams of fiber.
Yeah. Yeah.
Like the math isn't mathing, right?
This is great. Yeah. So the seeds.
Yeah.
Deb,
Super
They
tea.
also have a
It's like-
tea. They have a tea.
Deb is like, they have a tea.
You can travel with it. I can pop
I was
those
like,
packets.
excuse me, like to pardon this podcast, but I'm getting anybody else? Anybody want the cereal, the tea? There's a supplement.
I know. I'm
We're-
gonna go.
Like a champion, guys. Poop like a champion.
That
This is
actually,
great. Yeah.
do I dare say that will be the title of this? I mean, I was thinking.
Can we do
this
that?
podcast
Can we
would
call
live
it
with
that?
your gut?
I don't know. Do we have to ask them for rights? Like again,
I
I'm
will
not
message them. I will message them. I'm going to
You
message them.
message them and tell them that your nurse practitioner has been using this stuff for like
I will.
15 years, 13 years now.
That's my task. Message Poop with Champions.
And I tell all my patients about it because when we talk about fiber, right? Like we're talking about gut health, and a lot of times I'm also counseling patients on weight management. Why is this so important? Because fiber, and we were kind of talking about this before we jumped on, but we always say protein, protein, protein. Yes, protein is important, but if you're not moving like you're supposed to, your body isn't expanding the energy that it needs, right? So we're pumping our body full of protein and we're actually gaining weight. We're not losing weight. What the hell gives? Because that we're not utilizing it, right?
Yeah.
So we need to focus on fiber. Physiologic, and I tell patients all the time, they're like, oh, I don't have a problem pooping. I'm like, well, God bless you, because most of my patients do because of perimenopause, menopause. But, again, that's what fiber's for, but it's not what fiber's for, right? Physiologically, what it does to the body is it helps regulate insulin levels, blood sugar levels. It helps suppress ghrelin and leptin hormone, and it helps increase your natural GLP-1 in your gut. So then you have that satiety, that reward center, right?
Yeah.
You're satiated and everything kind of just like flows. The way
Right. Well, I think of it as like, it's sort of like the roller coaster of your bowel. You know what I mean? It like
Right.
grabs onto everything that shouldn't stay there that long. And it just, the fiber just pushes everything back out and it just helps with your sugars and with everything like that. That's how I look at, like, it
Cholesterol,
helps down a bit.
triglycerides,
Cholesterol. Yep.
triglycerides, you
Yep.
know? So
Which
that's
keeps that's going up also for nobody knows. Well, we know, but it keeps on going up. And I was like, I'm eating the same stuff, but with fiber intake, it does decrease. So I'm on the
fiber
fiber train.
fiber and fatty omega-3s. Those are gonna help. Those are gonna help your triglycerides. Um, and now going into, like, healing that gut, what are some things that we can do? So, glutamine is great,
Hmm.
zinc is great, collagen, um,
Mm,
berberine again helps the gut biome. Berberine helps, regulate insulin, regulate blood sugar, right?
yeah.
Um, you can also utilize, obviously, adequate fiber, adequate hydration, right?
Yeah.
Um, the targeted supplements that can help with not just healing the gut lining, but also supporting liver and estrogen metabolism. DIM is a great supplement.
What's that?
Dimethylene I call it DIM because it's so much
Okay.
easier. But it's a bunch of
Probably this long.
cruciferous vegetables.
It's long. Yeah.
The word is like this long. Um, but it's a bunch of cruciferous vegetables, broccoli,
Oh,
kale.
Broccoli. Yeah.
Um,
okay.
so it has antioxidants in it. There's a lot of information coming out on um, cancer preventions. It helps down regulate some of the bad estrogen, right? So, like estrone, it helps down regulate that. Those are all supplements that are beneficial in hormone regulation and gut health, right? And kind of restoring that gut biome, which is what we're needing.
Yes.
Um, one other medication that I like to use for inflammation, um, that I it's some providers use it, um, low dose naltrexone. Low dose naltrexone is the jack of all trades, master of none medication. It's used for so many different um, ailments. Um, in 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 the hospital, Mare, you or your husband would know it as Narcan, right? What does
Ooh.
Narcan do? Narcan it has two different pathways, right?
Yep.
So we have the opioid and then we have the inflammatory pathway.
Hmm.
So if somebody comes in through the ER or somebody gets too much medication and they have to reverse that, they give them large doses of Narcan,
Yep.
right? To kind of kick out those opioid receptors.
Yep.
Um, low dose naltrexone, which Narcan is naltrexone, low dose naltrexone, we work on the inflammatory pathway, right? So
Hmm.
we're fixing issues with joint pain.
Yeah.
Um, we're fixing chronic fatigue. We're fixing gut issues, IBS. We're patients who have Hashimoto's. We need to be really careful with that when we prescribe. So we titrate really slow going up, but there's so many benefits to that to low dose naltrexone for gut
Yeah.
health as well because it helps with inflammation. Um, when used in conjunction with Wellbutrin, it's actually, contrave for weight loss, but it helps with weight management. In some patients, there's some articles coming out with, infertility. So, low dose naltrexone is also a great medication that we can use to help reduce inflammation. Um, peptides, BPC
Mm.
157, KBP, those are all anti-inflammatory peptides. Those can absolutely help with gut health. Now, again, going back to your when we first got on, Deb, a lot of times insurance don't cover these things, which is very frustrating. But if we can find compounding pharmacies that are
Mm.
reasonable to help get these
Yeah.
things out to patients, I offer it to my patients on Women's Institute for Specialized Health, right? Um, there's different therapies for different things that I can help patients with. Um, and then obviously the other thing that we want to look at um, for for helping women get through this is just addressing hormone deficiencies, right? Reducing that inflammation, restoring motility, um, and improving the serotonin regulation, which um, will happen once all these things are fixed. Um, you know, when women say, "My gut worked so great in my 20s," right? And then I have to tell them, "Well, so did your hormones," right?
Yeah.
Hormones were
Yeah.
great in your 20s. So, um, there's a lot to be said about hormone health and gut health for sure.
Yeah. Yeah. I think that, oh my gosh, I know we did not really go down a lot of rabbit holes
I'm
because
surprised. I tried to be good, Mare. I tried to be
no,
good.
you did great. You
You
did
did
good, but
great.
it's you're such a wealth of knowledge and information, and you make it so user friendly. You know that's I mean, how more user friendly than poop like a champion? I mean, that is right. That is right up there, girl.
Oh,
But listen,
I'm filling out their survey right now.
You are so hilarious,
don't
Deb.
let the
No,
fact that you're on a podcast,
I
don't
am. It's
let that
okay.
affect
I'm
you.
not.
Fill out
No,
that
but you know
questionnaire.
what? I think it's important for women who are listening to realize we're just like them.
Yeah.
We
Yeah.
are just
No,
like
it's
them.
so I mean, seriously, I
This is a
literally am
big
gonna
deal to me.
every time I've gotten off with a podcast with I have gone and like I will look up this consul. Don't even know what it is, but I'm going to look that up and get it. I am getting the poop like a champion, and I am making sure that I have all these omega 3s and because you hear one thing and take this supplement and I have a lazy Susan in the corner of my
Mhm.
it is filled with everything that you can imagine, and I'm like, yes,
And this is
yes,
just morning. This is just
yes.
morning.
Thank you.
Right.
I have a morning one like that and a
I
aft and one with meal one,
Deb
that's
will,
a
Deb
smaller
will
one,
tell
and then at night.
okay.
It's hideous.
I
It's like at 95 years old.
Yeah.
You guys are amazing because I was just at my bone health appointment and
You
she
need
said, "You need."
testosterone for bone health.
Well, I'm on
Yeah,
that now. But
yeah,
Okay,
she
good.
had
so
said to
stop it.
me, you need to have take some kind of a gummy or a thing." And I said, "I won't remember and I won't do it. So don't even tell me to take a pill." So I'm going to get a shot like once a year. They're going to see if I get okay for that. They're going to do like an IV thing. Because
Yeah.
Oh, yeah, yeah.
I was honest with her. I said, I have like 4 jars of calcium that are expired underneath. I just threw them away. I buy
Well,
them
I
and then I don't use them.
I get it.
yeah,
I get it.
I
It's
do
But I
the thing like you do with the everyday, and then if you get a little brain foggy, you're like, "Did I take that?" And then you look and you're like, "Oh, yeah, Monday, it's empty, so I
yeah.
must have taken
okay.
that maybe."
Well,
Yeah.
and this is what I tell patients too, because first of all, listen, it sucks. We can do it gracefully, right? It totally sucks because my son, my 22-year-old son, walked in and he goes, "Mom, you're officially old." And I was like, "No, babe, this is all supplements." And he goes, "Yeah." Like, my point.
It's so true. At lunch, I'll take it to lunch at work and I like have it in like a little container and they look at me and they're like, "What?" And I was like, "Oh, just me and my 12 pills. That's it." And
Yeah.
they were like, "Well, do you know what they are?" And I start, "Well, this one is this is that." Yeah.
Yeah.
And I'm like, "Oh yeah, I see what you're saying." Yeah. I was
Yeah.
like, I just scoop them back up and just take them. I'm like, but it does help. So
It does. And so it it's a full-time job, what I tell patients. Your health, this is why you have to invest, right? Like thinking of it as an investment is
yeah.
your health is your investment. It's a full-time job. We want to make sure that you are taken care of and that um that you're feeling good. And I always tell patients, your gut's not broken, you're not broken. You're not imagining all these things. This is uh, you know, this is all fixable. You deserve answers. Find a provider who's going to listen to you, who's going to believe you, and who's going to help you. And there's testings, like I said, the GI mapping can be done, SIBO breath test. There's a lot of different things that can be done depending on how you feel, the how extreme your symptoms are. Um, again, I have quite a few patients who have come to me who have been eliminated on everything and they are miserable. And
Yeah.
we are working to get things right again, right? So, that other fiber, do you want the recipe to that?
Oh yeah, the bar thing or
The protein. So it's a protein powder fiber powder that you can also incorporate. So,
okay.
I mean, obviously you don't want too much. So either like pick
Started on a weekend.
start it on the weekend and you don't have to do it every day, right? Like you can alternate, maybe like poop like a champion, maybe do this, maybe do that.
Yeah.
So you want to take 1 cup of pumpkin seeds, freshly ground. You're going to do half a cup of chia and flaxseed each. Ground those up, right?
Okay.
You want a quarter of a cup of Ceylon cinnamon. Cinnamon's amazing for gut health.
Ceylon, is it a certain kind? Could it just be any cinnamon?
It's Ceylon, Ceylon.
Yeah. Not how I
And
spelled it.
and a quarter cup of cacao, so the dark chocolate powder.
Oh.
You don't have to do the chocolate, but you can, right?
Huh.
You want to put everything together and pulverize it, like make it into like a fine powder.
Mhm.
Um, and that should, for one person, that should be like half of a batch. So, um, you want to put that in an airtight container and 1 tablespoon. So you can do 1 tablespoon, but if technically to get the 16 grams of fiber and the 16 grams of protein, it's a quarter of a cup, which I think is 4 tablespoons to tell you the truth.
Yeah.
Yeah.
1 tablespoon
So
or a quarter of a cup. Yeah.
yeah. So
And you
that
put
will give
that.
you that. You can put that in your smoothie. So like Deb, if you wanted to use your almond milk and do that, that
Yeah,
will give you 16 grams
that's
of
good.
Oh my gosh.
protein
That
and
would be
fiber.
wonderful.
Throw an avocado in there.
Oh
Throw a half
yeah,
of an avocado.
Or
Make it
and
throw
some
half
blueberries
or
and
throw
some
a quarter of a
blueberries.
cup of
poop
poop
like a
like a
champion.
champion. You'll be pooping like a champion.
My
Um,
I have all of these seeds, believe it or not, except for the cinnamon,
the
but
Ceylon cinnamon.
put regular cinnamon in for now just to try it. But I will and I have an avocado.
Yeah.
I'll be
And
trying it tomorrow morning.
yeah, so I mean that's something that you can totally try, right? Just ways to think about getting that fiber
And
in
you
our
start
body.
off
And it's
already. You already start off instead of a negative. You already start off in positive with the amount of fiber that you have for the day.
for sure.
So
For
yeah,
sure.
I love it. Well, girls, I can tell you, we take away and listen for everybody listening out there. Gisele is amazing. So you can see her at its Wish Foundation, right? Wish Women's
Wish
Health.
so it's Wish Health. So
Wish Health.
www.wishealth.net. Or
.net.
the menopause. You can go through the
Or the
menopause
menopause.
website.
Yep. Through menopause also. So it's easier to, but you need to find her because literally you are what helps people feel the best that they
Yeah.
can in menopause.
Thank you.
Yeah. I told you,
I'm
I have a girl crush on her, Debbie. I've already
I
said
know.
that.
Well, it's okay. I think I do now too. But I because she shares about the champion of poop. I don't know, but
Yeah. Yeah.
I'm very what I really want to give you a heartfelt thank you because
You're so welcome.
you have brought clarity, compassion, and honesty to the conversation so many women like me need, and we rarely hear it. So your voice is helping women feel seen,
Thank you.
understood, and supported. And
Yes.
honestly, I have not felt that in many years. And today I actually felt it with humor as well. And I didn't feel
Yeah.
ashamed to say I'm going to order poop with a champion or whatever that's
Yeah.
called. So,
Yeah.
Listen,
but thank you.
we're all
Thank you.
going
Thank you.
through this. You're so welcome. And that's
Thank you.
we're all going through this,
Yep.
right? To some degree or the other, right? Some
Yep.
have it way worse, some have it not way worse. But
Correct.
what I've learned as a provider is you gotta listen. You gotta listen and you gotta believe. I mean, you gotta believe your patients, right? And I I don't know. I always say, I'm gonna figure it out. Let's figure it out, right? Um, I just had a phone call on Saturday, a patient, she's like, I don't know, I've gone to so many patients, she young, not even 40 yet. And she's like, "Nobody's listening to me. Can you see me?" And I said, "I can absolutely see, let's get you on the
Absolutely.
schedule. Let's talk," right? Um, but it's so important for women. You guys, we're not crazy. We're not
Yep.
This stuff is actually happening to our bodies, right?
It
Um, and that's what I just wanna the takeaway is, and I've said it before, we've gotta straighten each other's crowns, not tear them down. We've gotta
Yeah.
listen,
Absolutely.
right? We've
Absolutely.
totally gotta listen to our patients. Providers need to do a better job at listening.
Well,
She
we're
does a
grateful
great
to listen to you.
Yes,
Thank you.
absolutely, and I will tell everybody out there that's listening, our next one will be on the testosterone.
Yes.
Mm, mm,
My favorite. Oh, testosterone helps gut health too. I didn't even get into testosterone about gut
see?
health.
Well, what I mean, I think she deserves her own, like,
Yeah, for
I
that
sure.
think
one
that he
deserves.
does.
That testosterone I know that it's like everybody thinks it's a male hormone, but I don't make anything a he, I make it all a she, so she
But
See.
okay,
gets
so
her
then
crown.
so when and this is one thing, and you're absolutely correct in that, right?
Mhm.
Providers say that all the time. It's a male
Yeah,
hormone. Okay, so
yeah,
then why was it the most abundant hormone in our ovaries in our 20s, right?
exactly.
Mm.
Why
Yeah,
is it that men have estrogen, right? Whenever now I have a guy side, right? So
yeah,
I have a
yeah,
guy side where I treat guys. Um, I have to check their estrogen levels because if they have too much estrogen, guess what happens to them? They start growing breast tissue.
mhm,
So do guys get told, "Oh, no, you can't have testosterone because, your estrogen." No, they don't, right?
yeah,
Or you don't get
exactly.
estrogen. Okay, well, then why are half the guys on testo walking around with a aromatase inhibitor on board?
Yeah, yeah.
Anyways.
So see, our next one will be so much fun. Buckle up, girls, because that'll be great. Yeah.
Yes, for sure,
So
for
Thank
sure.
you.
I just as we always say, I thank you again, and we will, like I say, see you next Tuesday.
Yes, ma'am.
Thank you, girls. Thank you.
Thank you.